Thank you, Tina. Good afternoon. We weren't scheduled to have a news conference today, but I felt the need to be here to provide you with an update on one of our long-term care facilities, Northwood, that's dealing with an outbreak of COVID. I never imagined when I went to bed last night that I would wake up to the horrific news that an active shooter was on the loose in Nova Scotia. This is one of the most senseless acts of violence in our province's history. Words cannot or console the families affected by what has transpired over the last 24 hours. To the families of the victims and to those who are still feeling afraid, my heart goes out to you. Know that all Nova Scotians are with you. To the R.C.M.P, I want to say thank you for apprehending the suspect and for doing your best to protect the citizens of our province. And the R.C.M.P will be holding a news conference tonight, a briefing at 6 p.m. This is an active investigation, and I know many of you have questions, as I do. But now is not the time to speculate or to spread rumors. The R.C.M.P will provide you with as much information as possible. We have to let them conduct their investigation, and we have to let families grieve. We are all in shock that such a thing could happen here in Nova Scotia. And it is a heavy burden to bear on top of COVID-19. But now more than ever, we must stay strong together. There are a number of other families who are dealing with their own loss after their loved ones died of COVID. 5 people over the weekend who lived at Northwood, and I am so sorry for your loss. I can't imagine how difficult that is, and my heart goes out to all of you who are trying to find a way to honor your loved ones and say goodbye in this unprecedented time. We have implemented an emergency plan at Northwood to move patients who have recovered from COVID to a recovery unit at a local hotel. Shannix has donated equipment to support residents, including electric beds, tables, and other supplies, to assist with establishing an off-site care unit at the hotel. The first resident was transferred earlier today by ambulance, and I'm told that the family was there to wave as their mom moved in. A number of residents followed, and that will continue throughout the week. As residents continue to recover, they too will be moved out of Northwood. Those with COVID are being treated on site, and all testing will be conducted on site. Starting tonight, the Halifax Infirmary COVID unit will be redeployed to Northwood to help support the more acute needs of the residents. Our health authority has joined forces with the team at Northwood to support this emergency response. We have an additional 40 Nova Scotia Health employees, including nurses, continuing care, and rehab therapists. The VON, the Red Cross, and EHS paramedics have also joined in the effort. Students about to graduate into health-related professions have answered the call and are offering support as well. And I want to thank all healthcare workers and everyone volunteering to support Northwood during this critical time. Our healthcare unions have been very supportive in working hard to ensure their workers are also protected. Let me say thank you for what you are doing as frontline workers in our province. Now, Dr. Strang will give you an update on the COVID situation.
Thank you, Premier, and good afternoon, everybody. Today, indeed, is a very sad day in multiple ways. Before I give you an update on COVID-19, I also want to acknowledge the very tragic situation that's happened earlier today with an armed gunman. It is really hard to fathom, and I just want to express my sorrow and my support to the communities and the families involved. But unfortunately, that's not the only difficult news that we have to deliver today. Yesterday, we announced 3 residents at Northwood who had died of COVID-19, and as the Premier had said today, we unfortunately have to announce 2 more. That's 5 families who are grieving who will not be able to see their loved one again. I know that many families with loved ones at Northwood are concerned. I know staff are anxious, but I think I want to reassure the public, the families, and the healthcare workers that there is a robust plan. The healthcare system, as the Premier has outlined, has stepped up and is now right there with Northwood, providing the necessary response to this tragic situation at Northwood. Northwood is an excellent operator. I do have confidence in their work. The health system has confidence in their work. The reality is that they have a very large facility that COVID-19 began circulating very broadly. They have a number of residents and staff who have tested positive, and as a result, in the last few days, they have said they need help, and they are now getting the help that they have asked for. In terms of our regular case update, we have 26 new cases of COVID-19 today, bringing the total number of confirmed cases in Nova Scotia to 675. We currently have 11 individuals in hospital, 4 of them in intensive care. 200 people can be considered to be recovered from their COVID-19 infection, and we have 21,120 Nova Scotians who have been tested and have received negative results. Overall, in our long-term care facilities, we have 8 that have had 1 or more residents or staff test positive, and the total number of residents, long-term care facility residents that have tested positive for COVID-19 is 93 and 54 healthcare workers. It is clear that the majority of those are from Northwood, and Northwood is the active long-term care facility outbreak that we're dealing with right now.
Thank you, Dr. Strang, and we'll be happy to answer any questions.
Again, just a reminder, we will take 1 question and 1 follow-up from reporters on the phone in the allotted time that we have today. We'll start with Heidi from CTV. Go ahead, Heidi.
Hello. First question, just wondering why some Northwood residents who have tested negative for COVID-19 are still living with, according to reports we've heard, residents who tested positive. So you'll have a shared room where one person's negative, one person's positive. Why would that be happening?
So Northwood has as part of their COVID plan, they established first they established one, and then a second one, COVID units, where all of the people who tested positive were moved into those COVID units. But in the last few days, the numbers have grown significantly, and those COVID units have been full. So they've had to keep people up on wards. They have isolated them as much as possible. They're making sure that resident movements are limited. They're also being very clear that healthcare workers are taking the appropriate infection control steps, so they're not minimizing the chance of them transmitting virus from one patient to another. The plan that the Premier has outlined, which is start to bring people who have recovered out of the facility, will create more flexibility. First of all, it protects those individuals, gets them out of an outbreak situation. But as we open up some of their existing COVID units, we'll be able to bring more people in. It'll also create more space, and they can create additional COVID units. We also know that many of the people, even though they're testing negative, it's quite likely that they are already incubating, and because we're seeing many people that if you test them over a series of days, they go from negative to positive. So everything that can be done within that facility to separate the known positives from other people is being done, and the steps that are being put in place are going to enhance that ability.
Go ahead, Heidi, with your follow-up.
Why not take some of the affected residents to hospital, ones who have COVID-19 and are experiencing symptoms?
So that has been an active topic of discussion with clinicians. We need to understand that these are frail elderly people. Any move can be a trigger, a decline, and even moving a large group of people like this from one facility to another is likely to cause some people to die. So we have to understand that. We also know that for many of these people, this is their home. This is where they want to be. They have directives to not move anywhere else. The third piece is we have to understand that this is an active outbreak of COVID-19. Even moving people who are negative right now, or we know have tested negative, or we haven't yet tested, if we move a large number of those to another facility, we know the way this outbreak is going that we are going to move COVID with it. And then we've now created COVID in another facility or another hospital, and we do not want to do that.
I also think it's fair to say, like in community, anyone who requires to go into our hospitals will have access to our hospitals, but it's critical that we continue to protect hospitals across this province and keeping COVID out of them as long as we possibly can. But I want to reassure all Nova Scotians that if it's required and your healthcare team and your physicians require you to be in an emergency department or in an IC unit in this province, you will have access to them. It's why we've worked very hard to continue to reduce a number of elective stuff that's going on in our hospital to build that capacity. So if someone requires it, including those at Northwood, and the healthcare provider determines that case, we have capacity.
Next, we'll go to Mike Gorman with the CBC. Go ahead, Mike.
Thanks. Dr. Strang, to what extent do you believe that these measures that are being announced today will successfully clamp down on this spread that's happening at Northwood? And knowing what we knew about this illness in terms of its effect on the elderly and people with underlying conditions, should some of these measures at Northwood been taken sooner to get people out of there sooner?
So first of all, the measures to bring in enhanced care to move residents who have recovered will start to have an impact. We're also going in public health, working with the facility around enhanced testing in the facility. That's been going on for the last couple of days. So all those measures are necessary and are the right things to do. Everything we have planned for dealing with a COVID-19 outbreak has been dealt with from the beginning by Northwood. The reality is they had multiple introductions of this virus probably around 3 weeks ago, and it has spread substantially within a large facility. You have a limited ability to prevent the spread once it's introduced, despite all the infection control, all the measures we have. We are also learning a lot about this virus. There's things we know about this virus that we didn't know about 2 or 3 weeks ago. For instance, the evolving evidence around, growing evidence around asymptomatic spread, and therefore it was a week ago that we were implementing all frontline care providers in long-term care wearing masks. That was based on rapidly evolving evidence. So the appropriate things I fully believe have been done. We're evolving those as new evidence evolves, but also we're responding to a very large outbreak, a situation we have not faced before. And now we have a situation where this facility just in the last 2 to 3 days has become overwhelmed. So the rest of the healthcare system has responded in a tremendous way to provide the necessary supports, whether it's staffing from the acute care sector, whether it's community care assistance from the Nova Scotia Community College, the unions, the Shannex stepping up. Everybody stepped up to provide the help that Northwood needs in really an unprecedented situation in terms of the size and scope of this outbreak.
Go ahead, Mike, with your follow-up.
Premier, we had talked a bit on Friday about the top-up program that the feds have been offering for essential service workers who don't make very much money. We see that Northwood is still advertising for staff, and so I'm wondering whether or not, in light of how dire the staffing need is there, and in fact that some of the jobs they're advertising are low-paying jobs, whether or not you are revisiting the idea about accepting that offer. And if not, why not? And I wonder, and forgive me for trying to squeeze in a non-COVID question here, but do you think in light of what was happening in Portapique today, the province's emergency response text alert should have been sent out to residents?
The national government's put together a program. We've looked at that program. It really does not apply to very many healthcare workers. It may apply to some who would be part-time. We put a call and put a focus on, quite frankly, we've reached out in our healthcare system. I can't tell you how responsive really since last Thursday, Friday into the weekend. All of our partners have been from whether private operators, every union in the province has worked together, our community colleges, universities, to ensure that we're providing staff into the facility. I've said this many times. We have using some of the revenue that we have as a province to support those who are completely unemployed, and how do we best support them as we go through this journey, and we'll continue to focus on that.
Next, we'll go to Ashley Field from Global. Ashley, are you there?
Yes, hi, thank you.
I'm just wondering, in terms of some of the measures that you're putting in place to handle the outbreak at Northwood, are these measures that you plan to put in place at some of the other long-term care facilities that have also seen residents there test positive?
So we've had, as I said, we've had a number of long-term care facility outbreaks. None of them have spread to the extent in Northwood. So our I'll call it our more standard approach to long-term care facility respiratory virus outbreaks has been sufficient. In each of the long-term care facilities where it's been necessary for COVID, there has been a rapid response, and the rest of the healthcare system has come alongside and provided help, whether it's in staffing needs or personal protective equipment, and we'll continue to do that with every long-term care facility. The type of response that's required for Northwood, some of it is due to the size of Northwood. They're far bigger than our other long-term care facilities. But if we get a similar outbreak in another facility, the same type of support would be brought to bear if and when necessary.
Go ahead, Ashley, with your follow-up.
Okay, and my next question is still about Northwood. Obviously, this is a scary time for family members of those that are in Northwood. I'm just wondering how communication has been in reaching out with some of the loved ones, the residents.
So my understanding is we have a part of our response is in enhancing a communication team, but there was a rapid or a strong push on communication yesterday, and certainly what I've seen is some number of responses back from families very appreciative of the amount of information they were getting, the timeliness of information. That may not be in all circumstances. Appreciate that in an event like this, sometimes things get missed, but overall, the communication seems to have gone well, and it certainly is a focus of attention moving forward.
Next, we'll go to Mike from the Canadian Press.
Yes, good afternoon. I'd like to just clarify something. I believe it was said that there are some Northwood residents who are in the same room as with a positive test as those who have a negative test. That's the
area quite well. The horror of that would have impacted everyone in that community, and those who are scared are still grieving. A way of life that they have known has been shattered to them. I was reaching out to them, as I know all Nova Scotians are. Many of us grew up and live in small towns from one end of this province to the other, and listening to the news, that community is grieving. There's no question, and I wanted them to know that we were there for them.
Next, we'll go to David Jalla from Saltwire. Go ahead, David.
Hi, thank you. This is a question for the Premier, please. Given what's happened in Northwood and separate issues of what's happening in the various Quebec nursing homes, is there any consideration, Mr. Premier, to asking the military or considering the military to come in and help with whatever need you may see?
We have not entertained that. We put a call out with Health Authority, who responded along with to help support Northwood. Every one of our unions leadership put calls in wanting to participate, wanting to help. The issue for us is how do we end up, as Dr. Strang has said, we'll be moving people out of that facility who've recovered into another unit that we're setting up. That will allow us to move in behind with more cleaning staff, empty those rooms, scrub them down completely, and then be able to move people within inside of the facility. So as more people recover, that will allow us to have some capacity to move people around. As one of the earlier questions is about healthcare facilities, where we are attempting to deal with the issue of the outbreak of COVID by isolating people within that particular facility, but it will require all of our partners, and we have. I can tell you how proud I am of all of those organizations who've stepped up to support us over the last 4 days.
Go ahead, David, with your follow-up.
No, we're fine. Thank you very much.
Great. Next, we'll go to Ben Wood from All Nova Scotia. Go ahead, Ben.
Premier McNeil, you spoke with Prime Minister Trudeau last week about the province adhering to national standards regarding reopening the economy. And people are desperate out there. They're losing jobs, income. They're stuck at home. They're looking for details of that plan, any broad strokes. They're just wondering how it might work. Would it be daycares and elementary schools first? Would it be parks and restaurants second? Could you just provide some broad strokes of how that reopening plan would work?
Will vary across the country. Every province closed at different times and have closed different things. We will follow the leadership and work with public health to figure out how do we start opening up the province, but we're not there yet. This has been a hard weekend on our province. Our focus has been to continue to make sure we follow public health protocols, and then looking how can we look at potentially opening, whether it's our schools or our economy, and that'll be kind of a focus this week as we move closer to May 1st, when the deadline is for some of them to have where they were closed to the 1st of May.
Go ahead, Ben, with your follow-up.
I'm just wondering if the bulk of the cases that we're seeing are in Dartmouth East as well as the care homes. I'm just wondering if those clusters are keeping the entire province under lockdown, and if so, can those clusters be contained quickly so that we can reopen parks, businesses, daycares, and get people back to work?
Be clear, this is not one particular facility or one particular community. This virus is in every community across the province, so let's be very clear about this. We are one province. This virus will not divide us, regardless of whether economically or socially. We are one province. We are moving in, testing in areas. We would test in every other community, but let no one leave this press conference thinking that we are going to be a divided community. We started this journey as a province together, and we're going to end it together. And we will take the measures off the province consistently when we believe public health gives us this ability that we can protect Nova Scotians. Because if there's anyone out there who believes this virus is not in their particular community, they're fooling themselves.
Next, we'll go to Tim Bousquet from the Halifax Examiner. Go ahead, Tim.
Yes, thank you. Dr. Strang, my understanding is that the COVID wing that was, or zone that was set up at Northwood is the top floor of Northwood Manor, and the rest of that building is not residents per se, but tenants who rent apartments, and they're coming and going in and out of the building. None of them are wearing masks. They're catching buses all around town. Is there concern, or have any of the tenants, as opposed to the residents, been diagnosed with COVID, and is there a concern that there could be spread among them or out into the community?
So I've had a long discussion with that, or with Northwood. They've been very clear, two things, that their long-term care beds in their facility has been clearly separated from they have two other components, that some in the same building that are more I guess rental units, and then they have a second building which is a community living and people living independently. Their long-term care beds, where they're having the COVID-19 outbreak, is clearly separated, and where they've needed to, they put up barriers when it's in the same building, and there is no movement of residents or staff from the long-term care facility into the two other type of beds or accommodations that they have. There have been no COVID-19 cases in any of the assisted living or the independent living segments of Northwood. So yes, there are people going in and out of that building like they would in any other independent living apartment or seniors facility in HRM, and that's entirely appropriate, as I said, because the long-term care residence is specifically and clearly isolated and separated.
Go ahead, Tim, with your follow-up.
Yeah, I had two, but I guess I'll just ask one. Some little while ago, you said that you told me in response to a question that people who catch the disease and recover have built immunity. So I guess I'm wondering, why is it that you're moving residents who have recovered out of the facility if they're immune?
Well, we feel that in general that we anticipate, I think was my answer, anticipate like other respiratory viruses that people will develop long-term immunity. We don't know that for sure with COVID. It's a new disease. But especially in the elderly who may have not as robust immune systems, it's even more of a concern that they may not have a longer-term immunity. So the best thing to do is to get them out of the facility. They're protected. They're away from the outbreak. But the other part that does is that frees up beds in the COVID unit, so we can bring more of the people who are still within their illness and put them into more active treatment units, which then allows more flexibility behind them on other wards to do what we've talked about earlier, is a greater separation between those who are positive and those who we don't know what their status is or have a negative test. So it's for those two main reasons that we're moving those residents out. That's the strong recommendation. We've looked at all the options. Do you move the people who are known positive? Do you move the ones who are negative or we don't know about yet, or do you move the ones that have recovered? And consistently, the clinical advice is to move the people that we know have recovered for the reasons I've outlined, and then bring in the necessary supports to provide the necessary separation and the active treatment for everybody else within that facility.
Next, we'll go to Billy Joyce from CITU Radio.
Hi, Dr. Strang and Premier McNeil. Thank you very much for the work you're doing. Recently, WFAA ABC 8 in Texas reported that 39 elderly Texans successfully completed voluntary treatment of hydroxychloroquine combined with zinc, and apparently all 39 were successful. Just to put a little context, Dr. Eric Nepety, the owner of Nepety Wellness Center in St. Louis, Missouri, is also promoting the use of hydroxychloroquine with zinc. Dr. Vladimir Zelenko in New York used a cocktail of hydroxychloroquine, zinc, and azithromycin and successfully treated 899 out of 900 patients with COVID-19. And the only negative outcome was the result of a patient not following the protocol. We've recently learned that New Brunswick has approved a clinical trial for this, as well as hospitals in Quebec. And Dr. Oz, the famous TV doctor, is also singing the praises of this drug, combined with other drugs. Forbes magazine recently reported that India is also approving the drug to treat COVID-19. So this being said, and correct me if I'm wrong, why have we not heard of clinical trials of this drug in Nova Scotia, and why? And if the people dying have little to no chance of survival otherwise, aren't we at least using this as a last-ditch effort to save lives until the clinical trials are done?
So we do have one of my colleagues, Dr. Lisa Barrett, infectious disease physician, is leading a clinical trials as a Nova Scotia component of national work on a number of potential therapeutic options. We need to be very clear. Do not believe everything you read just because it's the internet, and certainly do not believe Dr. Oz. There's a whole lot of mythology around this hydrofluorocarbon treatment that if you actually look at the evidence, it's not robust at all. Any use of that needs to be, or any medication that's purported to be a treatment for COVID-19 should only be used under rigorous clinical trial scenarios. And we have clinicians here in Nova Scotia who are part of, participating in those national clinical trials. Please do not keep pushing out your information that's based on one-offs from who knows what the credibility of these people is. We have to rely on credible clinical science and clinical evidence to drive us, and there's so much misinformation out there on the internet that we just have to trust the scientists who know what they're doing and the clinicians who are doing the proper clinical trials, please.
Next, we'll go to Bill Martin from Six Rivers News.
Thank you. Dr. Strang, it's been quite a customary procedure for people to carpool to go to work, especially in rural Nova Scotia. And we learned recently that many people are still doing that, carpooling to go to essential services. Are they incorrect in carpooling? Many who've been doing the same for years.
So this has come to me, and one of my things coming up this week is some conversation with police on this. There's nothing under the public health order that says people they cannot be together in the car. What we have said to people is a couple of things. That first of all, you should only be driving when it's essential, and that if at all possible, you should not drive with non-household members in your car. That only makes sense. If you're together in a household with people, if you're together in the car for essential driving, that's okay. But there are some people that, and some circumstances have been brought to my attention where they are driving, they need to get to work because they're part of our essential workforce. Only one of them has a car. And so they need 3 or 4 other people in the car. So that is their only option. So what we're saying, as much as possible, non-household members not in a car. If you have to be, try to space it out so you can maintain as far apart as you can. But I realize that for some people, there may be 4 or 5 people that is the only way they can get to work is to have them all in a car. And then they go to work. It's not ideal, but we also have to understand that the realities of some people's lives, and they don't all have the resources to have their own car. We still need them to be at work. So we're working with the police on making sure that those people who have to be in those situations aren't ticketed or fined.
Bill, did you have a follow-up?
Thank you. Dr. Strang, you've correctly identified the situation. We're led to believe a number of people working in essential services are precisely in that boat in Cumberland County in particular. And they have been diligent enough to try and approach the R.C.M.P. to get some guidelines and some direction out of fear that should they be stopped on occasion for whatever reason, might find themselves with hefty fines. How would you direct them then where they feel they have no choice but to continue carpooling? How would you direct them to deal with police under those circumstances?
So I think they need to understand, help the make the police know of their circumstances and why they're doing what they have to do. As I said, on my big list of things to do this week coming up is to engage police on a number of issues like this. I was actually in a conversation with some people from Sobeys on Friday, and this came up. So what I suggested to Sobeys is maybe the employer give those people a letter that might help them in their conversation with the police about they need to go to work, and this was their only option, and a letter from the employer. So if people are in this situation, maybe talk to your employer and get a letter as well. This is, again, an area where we just need some common sense to be applied all around.
That's all the time we have for questions today. Go ahead, Premier.
Thank you, Tina. This has been a devastating day, and it's okay to be sad. It's okay to be angry, and it's also okay to feel helpless. But what's not okay is to bear all of those feelings alone. You have to reach out to a loved one, to a friend, to a neighbor. And if you need more support, that's okay too. We have a provincial crisis line that is available 24/7. If you need help, call 1-888-429-8167. What happened here in our province is not who we are. It may change us a little, but it cannot define us. We are strong, we are community-minded, and we take care of each other. So let's do that now. Let's do that together.